I'm the videotaper, Morgan.
Okay, so basically we're just going to be going over some oral health that you can be teaching your future patients. Also, welcome for the new ones, and then congratulations to the ones who are leaving. So we're just going to go over some of this stuff. That way, whenever you do get into the field, you are a little bit more comfortable talking about oral health with your patients because you are inevitably going to get questions. We are actually all prior dental assistants. So you are definitely going to be getting questions from your future patients, and hopefully this will kind of help you set you up. That way you feel a little bit more comfortable answering some of their questions as far as oral hygiene goes, okay? This is your, okay. So this is just basically goals and objectives of our presentation today. We don't really have to read it. Your target population, and then we're here at Concord. Okay, so this is the first question of the little quiz I'm gonna have you take. So if you could write at the top of your paper just pre, and then the question is, what is this radiograph used for? And then answer A is to see the apex. This is a bite wing, by the way, if y'all can't see it back there. This is a bite wing x-ray. Answer A is to see the apex. 2 is to check for gingivitis, B. C is to see interproximal caries or cavities, and then D is to see growth and development of 8 to 12 years old.
This group is not the radiology.
Yeah.
I can answer it for you.
Oh, you're still there?
Go back.
We still can answer that though. We know some of that, no? No, you know, really, what kind of stuff?
You want to pass it or like
Emily, you've been through radiology. Do you know the answer to that?
Yes.
y'all can see it
A
back there?
bite-wing X-ray, the
I'm gonna
purpose.
kind of like move
Yeah.
it. But don't share. Don't share.
Did you answer it, Emily?
I know what it is, and they said not to share.
Yeah, we don't answer
don't
a few
share it.
questions and then
We're
we'll.
seeing what they know, and then we'll go over our presentation,
Okay.
and then we're gonna ask them again.
Okay.
HJ, open contacts. Make you feel better?
Just to make sure.
Alright. You're confident? Maybe?
Everyone got a chance to see it, everyone's good? Okay.
Okay. So then the next question here is, what foods help remineralize teeth? So what helps build the teeth up? So you'll have option A, broccoli, option B, cottage cheese, option C, strawberry? Okay. Yep. And then option D, turkey.
Of course not.
I'll walk this around for you all. Very interactive presentation.
Good exercise. Get our steps in this morning.
Next question is, which out of these things has the most fluoride in it? Choice number 1 is tea. Choice 2 is coffee. Choice 3 is apple juice. Or choice 4 is community fluoridated water.
Just get the gears turning.
I'll come down for everybody else.
It's okay.
Yeah.
Everybody good?
Okay, now we've got the last question.
Okay. How many times a day does the ADA recommend flossing? A, 2 times a day, B, 3 times a day, C, 1 time a day, or D, 0 times a day?
Alrighty. So believe it or not, there's like multiple methods on toothbrushing, on how to brush your teeth. It's not just put the toothbrush in, do a couple circle motions. There's actually different methods. So the most widely used method is called the modified Bass method. This one's pretty much always going to be recommended by your dentist. So what you're going to do is you'll take the toothbrush and you're going to angle it at about 45 degrees. That way you're going kind of underneath your gums. You'll kind of go back and forth, and then you'll start to do circle motions. And this is going to help get a lot of that plaque and bacteria out from underneath your gums.
We're going right here underneath the gums. Our target's to get underneath the gums here and kind of go back and forth and do circular motions. So this is just to help stimulate gingival health. We're underneath the gums.
And you said it was called what again?
Modified Bass.
Modified
Thank
Bass.
you so much. So we're down here. Sorry, like fingers go girl. You see that?
That's
Alright, yeah. So make sure we're angling it up. Okay. Now the next one is going to be the opposite. This one's called the charter technique. This is a good technique for any patients that have orthodontics, braces, gum recession, partial dentures, any big spaces between their teeth. So instead of angling it up like you would with the Bass method, you're going to angle it down and do the same exact thing. You're going to do left and right, start doing circle motions.
Everything between them. And with the toothbrush, you'll like want the bristles going back and forward.
So, along with brushing, you should floss. And everybody knows about the string floss. Everybody's seen that, but there are many other ways to floss. So we do have the string floss. A lot of times people don't have the manual dexterity, or men will claim they have giant hands to not be able to use floss because they're so manly. We have other things to use. This is called a tuft brush. It's one tuft, just like you would see on your toothbrush. There's 20 of them. This just has one. That could get into areas where maybe people have crowding or crooked teeth, and there's just a kind of a catch-all. If you have people with braces, can get in the back, in between their braces. If they have big spaces, they can clean in there as well. Well, they wouldn't come that way, but you can come in. It's just a single tuft to kind of get those really specific areas. Then we have an interdental brush. There's not a brush in here, but there would normally be like a little, oh, there's one right next to
A couple of them.
Okay, so you see this like little Christmas tree looking thing? They come in all different sizes. This one looks like it's probably the giant one. They come teeny tiny. It just goes between their teeth. And sometimes older folks who can't use floss or floss picks or anything can use these to get to the very backs. And then if they have those huge embrasure spaces, that's space between your teeth, you can clean that out really well because not everyone can use floss. And then for our folks with braces, you can't floss up and down on braces, so we have what's called super floss. It's got this sort of stiff end on it that acts like a needle to thread it through the teeth. And then there's a fluffy piece to get all the big stuff out, and then there's just a normal piece of floss on the end of that. So you can teach them to come underneath the braces, pull it through, floss around, just like you normally would, and then they can pull it all the way through. And so they can get up underneath those braces. Is that all we got?
Ain't no excuses.
Yeah, that's right. That's right. There's a way. And then this is just a gum stimulator. This is for people who maybe have periodontitis or they're having some recession. You can use this with folks who have like swollen gums. It just kind of stimulates those gums to get some air down in there to promote healing. And it's just a little rubber piece. You guys can pass these things around too if you want to see them. Things.
Can we find these like anywhere?
Walmart.
Yeah.
Like Walmart?
Walmart,
CVS,
CVS,
Yeah, I guess I
Amazon.
never knew nothing about it. So I
No
never
one
was
pays
like-
attention. They see the string floss and they
Uh-huh.
don't see all the other things right next to it for people who can't use string. Exactly. A lot of people don't know. And then also a water pick is really great too, just for a water pick.
So it looks like a little water gun, and
Yeah.
it sounds like what it is. It's like a water gun. You place it at the gum level, and it'll shoot water
Sort of.
underneath the gums and kind of just flush all that stuff out. It's really messy. There's like learning curve when it comes to water picks. I have made like the worst mess in my bathroom with my water pick, but it's actually really helpful and can sometimes be more helpful and at removing plaque underneath the gums than actual traditional ones.
Especially if you have like patients who are elderly or like kind of have disabilities who can't and don't have that dexterity, it's a really good option for them to get clean.
And then people will straight up just refuse to
Or that.
use string. You'll run into those people that the only time I'm gonna floss is when you do it, or I'm not gonna floss. Like, okay, well maybe try a water pick while you're in the shower.
Yeah.
It's kind of the easiest way to do it. I won't lie, because everything's already all wet.
And then as far as flossing goes, how many times a day is recommended to floss? We are actually recommended to floss 1 time per day per the ADA. Doesn't necessarily have to be in the morning or night. Just make sure that we are at least flossing once a day to remove those accumulations of plaque, biofilm underneath our gums.
Is there such thing as too much flossing? Cause I got them little pieces and I just use
That's what I do,
them.
like 4 times a day.
Yeah, it just, if you're doing it correctly, but if you're like snapping it in there and
But
being
that's
really
not good.
aggressive, you can actually tear your gums up and make them recede. And so that's kind of worse off. There's a sweet spot.
Yeah. So as far as that goes, we can touch on that for just a second if you'd like. Because like she said, we're not looking to snap the floss through the through the teeth. Can I borrow that for just 1 second? So we're actually wanting to do like a seesaw type of motion. So we're going to place the floss in between. We're gonna place the floss in between and kind of just rock it in there. That way we can gently get it in without forcibly snapping it in there, because that motion of just like hitting your gums over and over again over the years will actually cause your gums in between your teeth to become blunted and can actually recede away and cause sensitivity and Make your teeth actually look longer if you've seen those elderly people though. But yeah, so we're gonna want to do a seesaw motion, get it in there, and then hug your tooth and just kind of go up and down with that. It's called the C-shape method. All right, so moving on, we're gonna go. Okay, so we're gonna talk about healthy teeth. So healthy teeth starts with a healthy diet. I'm just gonna read this little prompt. For healthy living and for healthy teeth and gums, think before you eat. It's not only what you eat, but what you eat that can affect your dental health. Eating a balanced diet and limiting in between meal snacks. If you're on a special diet, keep your physician's advice in mind when choosing foods. So we do have a little activity here. If anyone wants to volunteer, we're gonna actually place them in order on the remineralization of teeth and what foods are better for your teeth and what can or will cause more cavities or can cause more cavities, excuse me. So if anyone wants to volunteer, we have a couple of different options. We have cottage cheese, yogurt, pretzels, bananas, eggs, broccoli, and caramels. So we're gonna go from the least to the least foods that can cause the least amount of cavities. Sorry, I'm getting tongue-tied. I love that. So we're gonna go from least to greatest. So if somebody wants to come volunteer and just place these in order for us.
I'm going to go.
Okay.
Okay, so least.
Nice.
Easy, take it easy.
She is ready.
I love it.
My bad. So this is like not the least. Even though you guys kind of like that. Let me see. I'm gonna say the yogurts are like not good at all. Maybe. This is a really salty snack. I mean, here, this is like really horrible. So this is plant caramels. I say eggs are pretty healthy, right? Like one egg. You know what? It's okay, guys, because you know if I'm wrong, then that really helps.
That's okay. That's what we're here for.
Yeah. I'm not doing this. Hey, this is supposed to be. Boom.
All right. Okay. That looks pretty good. Does anyone else want to give it a shot on reorganizing this?
I think the banana should go first.
So you think banana should go where broccoli is? Bobum, do you want to come up here? No, we're just okay, cool, that's fine. I love that. Okay. Final order. Anyone else have any more input?
I think I kinda agree with the first,
You think broccoli should be first? Where do you think this should go? Yeah. The very beginning? Where are we putting bananas?
After eggs.
After eggs? Okay.
Oh, them eggs.
These are
I thought it was mango.
I also keep my eggs in a mango. Alright.
I love that.
Okay, so we'll go ahead and put them in order. So this is actually correct. Our cottage cheese, and she was actually completely correct. So cottage cheese has that calcium in it. Let me get over here to the prompt. So yogurt and dairy products are least cariogenic, which means they can cause the least amount of cavities because they can That's a hard one. I'm gonna have a stroke. They remineralize your teeth, which means it brings the pH of your saliva above 5.5. So the same actually goes with the broccoli. Yeah, actually me either. But that, we'll pass that. All right, so we're going same with the eggs and broccoli. So this has proteins in it. These keep your saliva at a regular resting level. So these aren't going to raise the acids in your mouth or lower it. So you can eat as much of that stuff as you'd like. And then foods that will drop the natural pH of your mouth below 5.5, which can encourage the development of cavities. We're looking at bananas, we're looking at caramels, and we're looking at pretzels. Caramels are actually going to be better for your teeth than pretzels because they encourage salivary flow. So when you're chewing, you're creating more saliva, and that'll actually kind of buffer the acids in your mouth. So caramels are going to lie before the pretzels do. Pretzels are a fermentable carbohydrate, which means she pointed out. So they're a fermentable carbohydrate, which means that they will lower the pH of your mouth. They can cause cavities, and they are dry, and so they're going to stick to your teeth, and they can cause decay. So this is our final. This is the order of best to worst.
What's the second?
The second one is yogurt.
Y'all gotta make sure the student center people stop giving us all these missing our teeth.
I was there. We also ate pretzels.
Oh yeah, we do.
It's fine. Make sure you rinse after 30 minutes.
Yeah. Alrighty. We're not here to judge.
Okay, so what are cavities?
Wait, can I stop you just a minute?
Sure.
Emily, you had something you were saying.
I was saying with yogurt, you have to be careful because it can't be the sugar yogurt. It has to be like the Greek non-fat.
Right, exactly.
Not the sugar yogurt.
Not yogurt.
Not
Yeah, now you'll play.
Bad picture. We'll
Not the
pretend that
Go-Gurts.
that's
not the
That's
Go-Gurts,
just
not the
Go-Gurts.
Danimals.
That's what Google gave us.
So you kids next one.
Alrighty, so cavities are generally more common among children, but adults are also at risk. So the types of cavities include coronal cavities, which are the most common type, they both occur in children and adults, and they are usually located on the biting surface from those pretzels. And so you also have root cavities, which you'll see more often in elderly patients because of the gum recession and the parts of the teeth are going to be exposed. And since there's no enamel covering that tooth root, this exposes the dentin, which can cause decay. And then recurrent decay, it's a decay that can form around their existing fillings or existing restorations because there are areas that have a tendency to accumulate plaque, such as when you don't floss in between those fillings. That's what's going to happen as a recurrent cavity. And then adults are especially at risk for cavities if they suffer from dry mouth. The condition is from lack of saliva. And then dry mouth can be caused by illness, medications, radiation therapy, chemotherapy, and it could be either temporary or permanent depending on the cause. And then cavities are very serious. If they're left untreated, a cavity can destroy the tooth and kill the delicate nerves at its center, which may result in an abscess, an area of infection at the root tip. Once an abscess forms, it can only be treated with a root canal, surgery, or by extracting the tooth. So we want to stop it before it gets that bad.
So how do you know if you have a cavity? Only your dentist can tell for sure whether or not you have a cavity. That's because cavities develop below the tooth surface where you can't see them. So what would we need to see below the tooth surface? X-rays. Let's see. So when you eat foods that contain carbohydrates like sugars and starches, the carbohydrates are eaten by the bacteria in the plaque, producing acids that eat into the tooth. Over time, the tooth enamel begins to break down beneath the surface while the surface remains intact. When enough of the subsurface enamel is eaten away, the surface collapses, forming a cavity.
Okay, so to prevent cavities, you would do basically what we've shown you today. Floss and brush using good methods, good practices, and the daily approach, not just when we feel like we need it, because you'll run into that. There will be patients that say, hey, brush when I need to. And it's horrible. And then eating that well-balanced diet. So, you shouldn't tell people, no, you can't have this, but say, hey, if you do this, then do this. If you have pretzels, drink water after. If you have soda, drink it quickly. Drink water after to get all of that out of your mouth. And then same with the kids. So you can do fluoride in drinking water, in toothpaste. You can come have it, or they can come have it professionally applied by you guys and us. And that's another way to prevent cavities in kids, because it's hard. It's hard. It's hard. And you know, there's just a lot of preventative ways, and we just wanted to communicate with you guys. We're on the preventative side, you guys are on the restorative side, and if maybe we can have a little cohesion, then there can be just a little bit of, you know, and almost arrest the caries process is kind of what the point is, to use these sort of things and just educate people, because you'll be surprised at the amount of people who just don't know any better. Especially that older generation, they never went to the dentist. Why do I need to do it now? Well, people are living until they're 80. Hang on to your teeth. And then the kiddos too, you know, it's just systemic health for them as well as everybody else. And if you guys can pass this information along, you know, tell people to eat their fruits and their veggies and their cheeses and keep their health, or keep their teeth healthy.
So what do Takis rank on that list?
Oh, no. They're going down
She's
to
at
the
the bottom.
Now we said don't tell anybody they can't have things. Start a fight. If you can fight, you can tell people. Have Takis, so it's not. Okay, so now with all that being said,
You could just flip your papers, please. Or if right at the bottom, if you wrote on the back, we're gonna do post, and we're gonna ask all the same questions and see if we get different answers than when we first came in. That is okay if you took notes.
it is A-okay.
All right, so starting off with, what is this radiograph used for? Again, this is a bite wing. Is it to see the apex, to check for gingivitis, to see interproximal cavities, or to see growth and development of 8 to 12-year-olds?
To yourself.
Just write it down. But yes, good job.
Okay, and then what food helps remineralize teeth? We have broccoli, cottage cheese, strawberries, and turkey.
Can it be more than one answer?
Just one
Just
answer.
one.
Just the one.
Which is the best out of these?
Yeah, but she literally got both of them.
Yeah, but we're looking for the best one
Oh.
out of these answer choices.
Sorry.
Okay, is everybody good? All right, and which of these has the most fluoride? Tea, coffee, apple juice, or community fluoridated water? This is a trick question, I apologize for not speaking honest. We sure
It's
did.
just a fun quiz.
Yeah, this one's for fun, don't take it to heart.
Yeah.
All right, since we didn't talk about that one, we'll just go ahead and keep on moving and give you the answer in a minute. All right, how many times a day does the ADA recommend flossing? 2, 3, 1, or none? Everybody good?
Yes. And Jessica, don't look at that.
All right, thank you. Okay, so going back to which one has the most fluoride, it's actually tea.
What?
Yep. I know, it was a trick question. I'm sorry. Please don't throw things. Yeah.
Oh, tea.
Okay.
Oh, so them answers was wrong on the, right?
Well, all of the other ones do have fluoride. Everything that you prepare with water has some kind of fluoride in it, unless it's bottled water, of course. But tea, out of all of those, just has the most fluoride because it's naturally occurring in the leaves.
Specific types of tea or all tea?
The
That's
one
a
that
solid
has,
question.
so the one
I
that
didn't
has-
have the answer for that.
So the one with the most amount of fluoride is gonna be your pre-made Lipton teas, the ones that are already like powdered mixes. Those have up to almost 900% fluoride in it, which is a pretty dangerous level. So if you really love your tea, I would recommend, you know, the regular tea bags, or if you can do, the raw organic tea. the herbal mixes, yes. So if
Yeah,
you
not the
just
scoop kind.
stay away from the pre-made ones and
Yeah.
go a little bit more naturally, you'll be
One that
okay.
comes in a jar.
I drink the Arizona green tea.
I do too,
Oh,
I'm
yeah,
drinking
me
it right
too.
now. But yeah.
We have a can in our classroom, don't worry. Alright, so that is our presentation. Okay.
If you guys wanna pass your
Answers back to us.
We need to write our name.
No,
we
this
just
is
need
actually just for
answers.
statistics, so
Oh.
if you could just pass
We
the
have answers.
answers.
You guys taking notes, so.
Yes.
Thank you. Okay, let me take a picture.
Yeah. You can take pictures if you want to take pictures of whatever notes. We did have a handout here. Yeah, you can do that.